The voice debate has an impact on the mental health of Indigenous Australians, who face higher rates of psychological distress, suicide, and trauma than the general population. For many Indigenous Australians, good mental health is linked to having a strong cultural identity, a sense of belonging, and positive relationships. But these factors are often undermined by the history of colonization, dispossession, and discrimination that Indigenous Australians have endured. The Voice to Parliament is a proposal to give Indigenous Australians a say in the laws and policies that affect them. It is based on the Uluru Statement from the Heart, a historic document that calls for constitutional recognition and empowerment of Indigenous Australians. The Voice is seen by many as a way to address the social and economic disadvantage that Indigenous Australians face, and to promote their self-determination and well-being. But not everyone supports the Voice. Some politicians and commentators have argued that it would create racial division, undermine democracy, or threaten the sovereignty of Parliament. These arguments have sparked a heated and sometimes hostile debate in the media and online, where Indigenous Australians have been subjected to abuse, vilification, and misinformation. This debate can have serious consequences for the mental health of Indigenous Australians. According to the E-Safety Commission, there has been an uptick in racial vilification of Indigenous people related to the referendum. Mental health organizations have reported increased calls and concerns from Indigenous clients who are anxious about the referendum outcome, or feel rejected or attacked by some of the rhetoric. Some Indigenous people also feel pressured to educate others about the Voice, or defend their position in hostile environments. The mental health sector has warned that the referendum could follow the path of the 2017 marriage equality postal vote, which saw an increase in mental health issues among LGBTQ+ Australians. The government has committed an extra $10 million to support the mental health of Indigenous Australians during the referendum period, but some experts say this is not enough. Indigenous Australians already have higher rates of mental health problems than non-Indigenous Australians. In 2018-19, based on self-reported survey responses, an estimated 24% of Indigenous Australians reported having a diagnosed mental health or behavioral condition. More than 1 in 10 individuals reported having diagnosed anxiety or depression. Indigenous Australians also have higher rates of suicide and self-harm than non-Indigenous Australians. These mental health inequities are linked to the social and historical factors that affect Indigenous Australians. Racism, poverty, unemployment, and disenfranchisement are some of the factors that contribute to poor mental health outcomes for Indigenous Australians. The Voice debate can exacerbate these factors by creating more stress, conflict, and stigma for Indigenous Australians. The Voice debate is not just a political issue. It is also a human rights issue, a social justice issue, and a mental health issue. It affects the lives and well-being of Indigenous Australians in profound ways. It is important to recognize and respect the diversity of opinions and perspectives among Indigenous Australians on The Voice. It is also important to ensure that the debate is conducted in a respectful, informed, and constructive way that does not harm or silence Indigenous voices.